Hello, my name is Terry Power. I'm an acupuncturist licensed in Australia. Acupuncture is now a registered health professional. So, just to let you know, in acupuncture there are about 2,000 acupuncture points listed in the human body. These are divided across 12 main meridians or pathways. The pathways are like magnetic field lines. And the idea is that these magnetic field lines are like the magnetic field lines of the Earth. In fact, our body is composed of about the same percentage of water as the Earth, the same percentage of certain salts and minerals, and similar forces flow through our body as they do as the physical Earth. These magnetic field lines apparently are very important to our health, our well-being, our healing, and our mental, emotional states. When there is an imbalance in the flow of energy or balance between these certain parts, meridians, then we get health, physical or emotional, mental disorders. So an acupuncturist primarily is like doing a fine tune-up on your body, helping the body to regulate its own homeostasis. That means how it functions in this world, how it regulates its internal functioning. So if we place a human body in an environment which is a little bit toxic, it has to adapt. So acupuncture helps to the body to adapt to certain circumstances. In fact, in ancient China, the acupuncturists and Chinese herbalists, they would see a patient about every change of season, because around the change of season, your body has to adapt to new stimuli, to new weather patterns, to new environmental patterns, and new stresses in life. And so what they used to do is give a treatment then. And the acupuncturists in those days were paid to keep you well. And if you became unwell, that's when you stopped paying them. So it's an interesting system back then. So they were very motivated to keep people well, to truly make a difference to their health. The magnetic field lines are not just an energy pathway. In fact, about 40 or 50 years ago, a Korean scientist did some experiments and he injected a radioactive isotope into an acupuncture point. And that radioactive isotope did not trace out any known blood vessel or lymphatic vessel, but it did trace out the acupuncture meridian. And he was able to show that there were certain little vascular elements, physical structures, that related to the acupuncture meridians. This is truly exciting work, and it has been corroborated by other researchers decades later. In the Western model of thinking, acupuncture stimulates the nervous system, but we believe as acupuncturists it does much more than this. But yes, it does. There's nowhere on your body, if you can tap anywhere on your body and you feel it, you know nerve endings are being stimulated. So the central nervous system up in the brain and the pathways through the spinal cord are being stimulated by acupuncture stimulation. So, by doing this, by accessing certain points, it has an effect on by dulling pain. It increases the immune system, it relaxes muscle spasms, it increases circulation, and for some reason improves the lymphatic flow within an area. When you think about it, really what we're doing is we're putting a metal splinter into the body. So what's the body going to do? It's going to think there's a splinter in there. So it's going to have a rush of energy to that area. There's going to be an improvement in your immunity, because with a splinter can come pathogens, viruses, funguses, yeast, molds, bacteria. So the immune system rushes to the area of that acupuncture needle. And hence, you get a rush of energy stimulating the points for healing. It's not that simple, because often in order to help a problem, we do distal and local points. So for example, if we have some abdominal issues, say some constipation, we will do some points around the bowel, but often we'll do points in the meridian pathways that are far away from that bowel area. So for example, we'll do the large intestine or the lung meridian, or possibly the liver meridian if we found the imbalance between the liver and the large intestine or the small intestine. So it's not as simple as just sticking a needle in the area that's sore. We're balancing out certain forces and we're actually improving the body to function. Traditional Chinese acupuncture has been around for thousands of years. In fact, the first acupuncture textbook found, the Neijing, it was written around about 3000 BC. So that's a long time. The ancient form of acupuncture actually started in India before it was adopted and fully developed by the Chinese. They took it and they just ran with it. They really got some sophisticated results and did some amazing things with their acupuncture. And there were some masters of that art. Acupuncture has been proven effective by the World Health Organizations and by research bodies. I'll just read you out a few areas basically. But the World Health Organization has a list of ailments, a long list of ailments that are helped by acupuncture and proven and likely to be of benefit. So I won't read out that long list because it's boring, but I'll write it up for you. It'll be written down. But just to let you know, acupuncture has been proved to be helpful for digestive systems such as colitis, constipation, diarrhoea, gastritis, ulcers, for the emotional system, anxiety and depression, gynecological issues such as heavy menstrual bleeding, painful periods, menopausal symptoms, pre-menopausal symptoms, and fertility. A lot of specialists will recommend, along with their IVF program, that people have acupuncture because it improves the effectiveness of their programs. Musculoskeletal systems, osteoarthritis, back pain, rheumatoid arthritis, tennis elbows, whiplash, just to name a few. Neurological, Bell's palsy, we've treated many of all of these. Carpal tunnel syndromes, headaches, Meniere's disease, migraine pain, paralysis and shingles. We've treated all of those. All of these above we're talked about. I've treated them personally, and it does. It works. I use a blend of acupuncture with chiropractic principles and kinesiology, but in its own right, acupuncture has shown successful. Vascular system, hemorrhoids, high blood pressure, varicose veins, and general chronic fatigue, giving up smoking, muscle injuries, obesity, stress management, tiredness, and travel sickness. That's just to name a few. There's many, many, many. However, the basic philosophy behind acupuncture is that there's two main forces. There's yin and yang. Now this is very similar to the contemporary Western understanding of the parasympathetic nervous system and the sympathetic nervous system, the fight and flight, these two opposing forces that are in nature. It's like hot and cold, or in and out. There's certain forces that are meant to be in harmony, and sometimes they get out of balance. So for example, if there's an overstimulation of the sympathetic nervous system and not enough of the parasympathetic, we will get health issues. So the acupuncture is actually aimed at modifying this yin and yang in not only the whole body, but in each organ area and along each meridian. There is also not only the yin and yang, it's then divided up into 5 elements, and often the body is diagnosed according to 8 patterns. I won't go into detail of the patterns, but for example, let's say you've got some phlegm on the chest. Acupuncture is aimed at moving and helping the body deal with the phlegm. So it's not just moving energy, you're actually targeting through specific points the phlegm or damp phlegm or phlegm heat that's occurring within the lung and why that's there. Is it a lung imbalance? Is it due to a kidney and lung imbalance? Is it a spleen-pancreas imbalance with the lungs? Acupuncture is also successful for pets. I've had many pets I've had treated with chiropractic and also acupuncture. I've treated many people for, many pets. Cows, dogs, horses, racehorses, llamas I've treated. I've had kangaroos hopping down my hallway in my clinic coming for their treatment. Wild kangaroos that have been brought in, little pinkies that have been brought in for treatment because the mother's been killed on the road and they're trying to be nursed up to health and released into the wild. Acupuncture is very, very safe, extremely safe, especially in the hands of a professional who understands the anatomy. Obviously, if you know the anatomy, it's safe. So, there's many different ways we stimulate the point. We use extra fine needles. These needles are so fine. The ones I like to use are 0.18 of a millimeter thick. They are so flexible, you can tie a knot in them. So this, you could actually bend it around, you can tie a knot in it. I can't right now because this one's too small, and it won't break. So it's safe as anything. You stimulate not deeply, but you stimulate gently. You're just stimulating the nervous system, you're modifying how the body is responding in a certain area, you're improving how it functions, and then that usually relaxes you and makes you feel fantastic because you're improving how the body works. Another method is through cupping. We actually put a flame in here, create a vacuum, and we suck that on. It's just a way to stimulate the body. It's a different way. There's also moxibustion, which is using certain herbs that you burn to warm the heat and heat up the acupuncture points. There is also ear acupuncture, which is very good for addictions and weight loss. See, there's many acupuncture points within the ear, and you can actually target those acupuncture points depending on the part of the body that it represents. And you can actually put a little acupuncture needle in under a little band-aid that's held in place to prolong the effects. So I'll show you a little bit of acupuncture and how gentle and safe and easy it is. Thank you. Okay, I'm just going to demonstrate a few little acupuncture points. This is Brandon. He's volunteered. I'll show you how painless it is and how easy it is. These are pre-sterilised acupuncture needles. We're going to work the liver meridian and gallbladder meridian on Brandon. So it'll come to the top of the head. The liver meridian opens up into the top of the head. So we're going to actually do a point on the do meridian. There. How was that, Brandon? Did you feel anything? Tiny, tiny bit. Easy as anything. We're going to come along the gallbladder meridian here. Here. Is that okay?
Yeah.
Good. And we're going to come to the liver meridian here. The 7, sorry. There. Good. How do they feel? Great. It's as simple as that. So I'll show you the points. So we'll point, acupuncture point here. Have one here. He's relaxed, he's happy. And one up here. It's easy as that. And then he relaxes and lets those points work. And we're also going to do a Chinese cup just here. I usually find it works a little bit better if we put a tiny little bit of grease on there, a little bit of coconut oil. And we put a flame in here to create a vacuum. Vacuum straight on. There. And that cup sucks on there nicely, drawing up blood, stagnant blood or congestion, drawing it up and helping to stimulate that liver and acupuncture meridian. Thank you.